Hello, friends. Welcome back to What's Good here at the Campbell University Center for Church and Community. My name is Brian Foreman, and I'm the director of that program. I'm thrilled this morning, or whatever time you're watching this, to introduce you to Dr. David Tillman. He's the chair of our public health program at the university. Knows a number of things about what we need to be paying attention to, the questions that we need to be asking, and I thought he might have something good to share with us about what we think about. What are some things we need to be considering as we see our churches move towards this opportunity, not so much of reopening, but regathering and reconvening. So David, let me just ask you the question we ask everybody to start off with, and what's good, man?
Well, first, let me just express my appreciation for being invited to have this conversation with you. I think there's a lot that's good. I'm in a position where I spend a lot of my time trying to convince people to be cautious and to take care in exploring the new possibilities as we begin to bring more and more things back to life. But the reality is that as much as I want people to continue to exercise caution, there is some encouraging data. There are some encouraging trends. We are expanding our ability to handle this pandemic in terms of having enough tests to be able to do the testing that's required and to have the contact tracers in place to be able to contain this. So these are things we didn't have a month ago that we have in place now. So there are a lot of encouraging pieces, and while we still are encouraging people to take their time in getting back.
Well, as people are taking their time, are there some best practices that congregations and clergy should be thinking about as far as what it means to come back together? I mean, there's so much information out there, and some of it is good, and some of it isn't, and it's oftentimes hard to know what to sift through and to believe. But you work with the data, you work with science, you see this every day. Where are some places we need to be paying attention as far as congregations?
Well, let me just commend to church leaders in North Carolina particularly, but even outside the state, you'll have access to this resource. Some interim guidance has been issued by the Department of Health and Human Services for churches as they think about how to begin gathering together again. And that guidance is really comprehensive. It draws from good science. So I encourage, maybe you can, as a part of sharing this, share the link. But that guidance talks about everything from the 3 W's that I know most people have heard quite a lot about, but we need to continue to make a key part of our messaging, which is that we're wearing the face coverings, that we're waiting and allowing that social distance of 6 feet, and that we're washing our hands as just basic prevention of disease, something we should have all learned in preschool, right? It's not just true in a pandemic, but it's certainly true in a pandemic. So I think, it has that element, but it has quite a lot more to think about in terms of, as church leaders are considering, when you bring people together, all of a sudden you have human resources involved, and thinking about your staff and your policies around making sure that when your churches begin to gather together, that your staff are very clear that if they have any symptoms at all, you don't want them in their position for that time, and making sure that you've thought about the environment in the church and ventilation. So all of those kind of pieces are in that interim guidance. So I really highly recommend that churches think about reviewing that almost in a checkbox kind of format. Are we doing everything we can if we're going to bring people together to check all of those boxes?
Do you think there's some pretty common mistakes that people are making? For instance, when we talk about it, it's like every time you ask one question, that uncovers 3 or 4 other questions of have we thought about these things yet? So one pastor I was talking to, they said we are going to do multiple services for different populations. Our most vulnerable population will be able to come at a time that's not a part of other things. And I thought, but your staff is going to be in contact with each of these different gatherings. So how are you making sure that there's no spread that way? So are there some things that we're not thinking about that we really need to grab hold of?
Well, I mean, that's an interesting question. There are probably things that we could point to there. But Brian, what part of me has been so inspired by some of the things that churches have done to re-envision gathering. And so, we could talk maybe about some mistakes that might be made, but I would encourage people to continue to use creativity and sort of liturgical latitude to think about what is it that our worship service could do to express not what we have the right to do, but who we are called to be in terms of service to one another. I mean, the enactment of the service itself could be this powerful message that we want to love you by protecting you. And we want to love you, the most vulnerable in our community, by not exercising some of our rights in order to make sure that you're protected. So I encourage faith leaders to continue to think outside of our norms to create community in ways that are the most powerful expressions of compassion and mercy, to say, I am going to limit myself in order to protect you. And so I would encourage faith leaders to continue to think about that. I know everybody wants to get back to normal, but there's something better than normal, right? Which is what I think we are called to be anyway.
Well, we know that this this idea of rushing back into things has seen some significant ramifications for some churches in Georgia and Texas. They got ahead of themselves, and when this pandemic really started to catch fire, you and I had a conversation, and I remember you saying, "Hey, this is potential anywhere from 12 to 18 to 24 month cycle where we could be looking at things happening with this." So when you start talking about the idea of being compassionate and not exercising some rights, you're also talking about exercising some awareness of what the reality of this virus that we're still learning so much about brings.
That's exactly right. I mean, even as we think about the most vulnerable among us, that actually, as we learn more about the virus, is widening. So I don't know if how many people were paying attention, but just this week, when here in North Carolina, the Secretary of the Department of Health and Human Services was briefing, she brought up the fact that we really thought kids were doing exceptionally well with this particular bug, that this virus was thankfully not affecting them in as significant ways. But there's actually some data that shows that some pretty significant things happening with some children now that's related to COVID-19. And so, yeah, I think we have to have a long view. The kind of creativity that, necessity is the mother of invention, right? So we had this moment where we had to think about how we were going to do this. Well, I think that moment is going to be for a while, and the things we create might serve us forever, because it might be ways that we overcome geography to connect to our community, to connect to people who are oftentimes isolated anyway, to make sure that we are using all of our resources, all the technology that we have, all of the creativity that we have to make sure people have connection. And, I do a lot of work in ordinary times when we're not talking about viruses, with people with disabilities who are oftentimes forgotten, oftentimes sort of isolated by various things. And these barriers are the kind of barriers we could break down in this time, because we have the opportunity to think differently. So I hope that we do some of that work. Yeah, and it avoids the tragedy where nobody brings together their church with the thought that, we can have one person infect 180 people. That's not what anybody wants. There's no church leader that wants that. Could be the reality, though. Mm-hmm. And the sad thing is that well-intentioned folks spread the disease and don't even know it. Somewhere roughly around 25 to 30% of cases are asymptomatic. So I don't want to infect you, but I might not know that I'm infecting you. And so how do you live mercy and compassion if my mere presence might make you ill without me knowing? Yeah. I think you have to really be, it's more of like the sins of omission. Like we're called to be conscious, I think, right now.
Yeah, I have to admit that one of my first thoughts when I read about the churches that had regathered and then people got sick and even some people had passed away, my first
Yeah.
thought was the moral weight of that, the theological weight
Ah,
of that,
yeah.
and just, it was deeply, deeply concerning and devastating in many ways. It's hard for clergy who find their congregations pushing to say, hey, we need to be back together. We need to be back together.
Yeah, and I think wise public health leaders have been acknowledging the fact that health is a big thing. Health is not just preventing yourself from getting this particular virus. And people's wellness, their wholeness is connected to community. And so there's also a lot of reason for us to acknowledge the fact that as a church leader, your congregation needs to connect. Your congregation wants to have the ritual in their lives. It's good for their health to have that. So there's where the balance, there's where the creativity, there's where the full complement of our resources is required. And I think, just being as wise as we can be is really smart. And that's, again, the guidance that was issued by the Department of Health and Human Services give you some very practical things to do if you're trying to meet that need to regather.
Yeah, and we'll make sure to post that link as well, folks. What's interesting to me is if we would have this conversation in January and I had said to you, is it possible for institutions like churches and universities to pivot in the span of 2 to 3 to 4 weeks to exercise that type of creativity in a non-pandemic world? What would your response be?
I hate to say it, but I had those conversations in January, and I was, sort of skeptical about our ability to do what we've done. I'm so encouraged by so much of what we did as a community. And, it's very, I'm reminded of the description in Scripture of being here for such a time as this. How often are you living in a moment that you're 100% sure is historical? Like, this will be a moment that is looked back on. And so church leaders, one of the things to ask yourselves right now is, what do you want to have said about you as a leader in this moment, in this historical moment, when this particular chapter is written in your church history, who you were? Let's think about the legacy that we want to leave in terms of this moment, because you're so right. We have already done amazing things that I don't think many people could have anticipated.
Yeah, I love a couple of things that you talked about. One is that there is guidance out there. We need to be paying attention to what the Department of Health and Human Services is put forward. There are public health officials that we can get information from if we're uncertain, and folks like you who are willing to give your time to have these conversations to help congregational leaders make some important decisions, and well beyond congregations as well, right? But then also this hope in our creativity and our ingenuity, the fact that we've proven we can do this, we can do something different. So there's a church behind my house. And they had a drive-in church, and the way that they were saying amen when they heard the pastor say something they agreed with, it's a little bit more charismatic tradition than I come from. Whenever they heard that, they started honking their horns.
Hey, this should return to that bumper sticker from the 70s, right? If you love Jesus.
Right. It was amazing, and it was so hopeful, because here's this strange, weird way of responding to the gospel. That's important, and it was community building, and so we can do this.
Yeah, and one of the other things that I would just say, in addition to heeding the guidance, is seizing the moment too to be truth and light. Right? There's so much fear and panic and frustration that churches need to be a refuge in terms of a place of calm and peace that passes understanding and truth and light. And so, these messages that are very basic, all the experts agree, the precautions that are just basic that we can take, just helping dispel some of the myths out there. Churches can be a part of that too. And one of the ways you can be a part of that is making sure that you're putting up signs to remind people that they have symptoms. We love you, but we're going to love you from afar, right? Don't come in. Putting up signs that say, please wear your face coverings. Please maintain distancing. It's a way to validate the truth of the science in the midst of chaos. And so I hope churches take the opportunity to be a part of the public health education too, when there's so much misinformation out there.
Okay, so two last things. One, if they want to make sure that they're combating the misinformation that's out there, if they want to make sure they're paying attention to what's factual, accurate, Health and Human Services information is a great go-to. Any others that you would recommend?
Well, I mean, and they're drawing a lot of their information from the CDC, and so which is obviously an important source of information in times like this. It's I'm a professor, so I spend a lot of time trying to encourage folks to check their sources, right? Think about where they're getting their information. So when I'm talking to my loved ones and my community, the message I'm giving is look for the source of the information. Governments, sources, academic centers. These are the places that you want to get information, and people are cranking it out from those places. Unfortunately, people are cranking it out from a lot of other places, so I would drill down enough. Actually, and the other thing that I can say is most of the major denominations have been really good about linking back and creating support for their church leaders and their congregations. So I think you can find really good stuff out there too if you look at the advice and the recommendations that have been given from the major denominations.
One of the things that our Associate Vice President for Spiritual Life at Campbell says often, every student hears this when they come to Campbell, is that Campbell is a place where we believe that a life of faith and a life of inquiry are not at odds with one another. And
Yes.
so what you're discussing is exactly that. The science is not to be mistrusted because a life of faith and a life of inquiry are compatible.
Absolutely. And there's this, not to get too historical on it, but there's this tension that's always existed, right? But that we've grown into where I think Campbell's a great place as a demonstration of this, but yeah, where we can use the full capacity of our reason to help discover God, right? And what God requires of us. And science is a part of that. And so I hope that folks won't shy away from heeding the science, heeding the words of folks who spend their lives dedicated to understanding our world in this way. But at the same time, look to faith leaders to make sense of the world as well. And to give hope when some of the data might be challenging to us, or when you see things like, there's a local long-term care facility that's had 14 deaths. It's just, that is a powerful way. We need to recognize that grieving in our community, what's represented there. The scientists can't help us do that, but church leaders can. And so we all have a role in helping to understand what the truth and the light needs to be in this moment. And I hope we can rely on one another in that way.
David, I'm grateful for your time. I'm grateful for colleagues who understand exactly what you just said about how we rely on one another. This is not an easy fix, and this is not an easy solution. And lots of churches are going to do things that disagree with one another. And there's a need for mercy and grace in the midst of that as well, as opposed to sowing discord. So we hope that anything that we've said today has not been about sowing discord, but has been about resources that are helpful for congregations and for congregational leaders to love and to do so with and to gather compassionately and when the time is right. So I appreciate you being a voice of reason in the midst of all this chaos that we're facing.
So it has been so good. It's always good to talk to you, Brian. And if I can if folks, you can feel free to share my contact information too. If I can be a resource to any folks out there, just sort of bounce ideas around or to talk about it. It's at the center of my heart to do so personally and professionally. So happy to do it.
Absolutely. Thanks again. We'll talk soon.
Thanks, Brian.